The National Health Policy was last formulated in 1983. However, it is my strong belief that the latest publication, Health Policy, was reformed in 2002. I have taken a look and examined the Health Reform Policy of 1983. The 1983 policy explained and gave general policies that required recommendations under very strict circumstances. Setting up a network of a complete coverage of healthcare services with a long extension of health education designed within a context of the key of the simplest health problems, the cold, diarrhea, etc., that can be resolved by the people themselves.
5 and 10 million. They don't come forward for testing. They don't know their status. They get married. Many marriages in India are arranged. The wife gets pregnant and she is found positive. The family blames her, saying you were a wicked woman. But it's actually the husband who would have given her the virus. When we find a woman HIV positive, we tell her, look, we need to test husband and wife together. So please bring your husband in, tell him it's important for the baby. So then he comes in and we counsel, then he agrees, okay, I must have given it to her. And then we give the reports to both. So we do a lot of couple counseling and family counseling. So otherwise the woman gets thrown out.
My conclusion is that people tend to walk away from problems and tend to look out for themselves rather than taking a chance to help others in need. However, not to be rude and mean, but also it seems to me that the government of India is not allowing their people to use resources. Instead, they live in a really poor, disease-infested area with contaminated water and no general income. Instead, by cheating the system, the women try and to get pregnant to beat the system. The majority of the health policies really need to be strictly enforced because you will try to have the child first. Well, if the child and the mother can make it. But also, you cannot raise the children in a family in India. To be perfectly blunt and honest, it really has taken me 2 solid weeks to try and to just find out what kind of goodwill will come out of India. During the past few years, I've realized and seen a vast improvement with that country. But although it's not a fast and quick recovery, it's still slowly recovering. With the latest headline of the H1N1 virus, or the swine flu, it definitely has the country shaking and scared. Because of the mutative design of that virus, a total of 4,885 confirmed cases and 134 deaths were as a result. And what really needs to be done in India is to uphold and to strongly set more regulated rules. Build up a very strong government to pay children more than below minimum wages and encourage women to work if they want to. Then again, we also have to put into account for traditions, basically saying women are not allowed to work or the daughters. I believe that the United Nations and also the United States should just step in and restore India instead of Iraq. We want to wage a war on hunger and starvation, not on a war for oil and other economic wealth. I think that's why we rather wage war on children with guns in Iraq, but can't feed one single child?